I'm Kelsey Timko, here to share my team's poster. Health Canada approved therapies for treatment of ALS, riluzole, and Radicava are eligible for reimbursement by insurers based on criteria set by the National Drug Review process. For riluzole, the criteria are an FVC greater than 60%, and for Radicava, patients must have an FVC of 80% or greater, item scores 2 or more on the ALS FRS-R subcategories, and a disease duration less than 2 years. Our objectives describe demographic characteristics and clinical features of newly diagnosed people with ALS and quantify those eligible for, prescribed, and dispensed riluzole and Radicava. We conducted a retrospective review of electronic medical records for patients newly diagnosed with ALS at the K. Edmonton Multidisciplinary Clinic in Edmonton, Alberta, between September 1st, 2019 and June 30th, 2021. 90 patients were newly diagnosed with ALS. The majority were male, with a median age of 65.6 years. The majority had limb onset. Median time to diagnosis was 0.9 years. Median FVC was 83.5%. Median initial ALS FRS-R score was 41. Of the 70 patients eligible for riluzole, 57 received prescriptions and 52 filled their prescription. Of 31 patients eligible for Radicava, hang on, we'll come back and finish this table, but twice as many patients were eligible for riluzole than Radicava. What's going on here? Some people were diagnosed more than 2 years after symptom onset, some by only a few months. Many people were diagnosed within 2 years from symptom onset, but were ineligible based on the other criteria. The missing data muddies things. But 20 of these people missed the eligibility cutoff by only one criterion. Some people had only one ineligible ALS FRS-R score. Of the people who were ineligible for Radicava, 25 were near misses. This suggests that additional eligibility criteria for Radicava limits patient access. If diagnosis processes were more efficient, more sensitive to single-site progression, and FVC was taken earlier in diagnostic investigations of potential neurological conditions, or the criteria were less restrictive, 25 more people would have had the option to take Radicava. The evidence for pathophysiological differences between people with ALS who meet the Radicava criteria and those who do not is weak, so a rethink of the criteria may benefit the ALS community as much as improvements to diagnostic processes. Anyway, where were we? Right, of 31 patients eligible for Radicava, 16 received prescriptions and 13 filled their prescription. 6 people could have done both but declined IV Radicava because they were interested in a clinical trial for oral edaravone. Not all eligible patients were prescribed the therapy or filled their prescriptions for either or both therapies, suggesting barriers to access beyond eligibility. This is a first step to developing strategies to help improve access for current and future ALS therapies. Thanks, go check out our poster.